Welcome, everyone! Today, we're tackling a subject that's both crucial and timely: reducing the stigma surrounding mental health. Despite growing awareness, mental health stigma remains a formidable barrier to people seeking help, impacting their well being and quality of life. In this episode, we'll unpack what mental health stigma is, its consequences, and, most importantly, evidence based strategies to reduce it. Hi, I'm Stephanie with Guiding Star Counseling. So, what exactly is mental health stigma? It involves negative attitudes, beliefs, and discrimination directed toward people with mental illness. This stigma can manifest overtly through hurtful comments or social exclusion, or more subtly through unconscious biases and stereotyping. The impact of stigma can lead to discrimination, social isolation, loss of opportunities, and most severely, delays or avoidance in seeking treatment. Research consistently shows that stigma has real and lasting effects on both individual mental health and public health outcomes. It undermines relationships and increases loneliness and social isolation, which in turn can worsen symptoms and impede recovery. Furthermore, stigma can create a vicious cycle where individuals avoid help, leading to untreated symptoms and reinforcing negative stereotypes. But here's the good news: stigma is not fixed or inevitable. There are powerful strategies to reduce and even eliminate it. One of the most effective approaches centers on social contact. This means creating opportunities for direct, meaningful interactions between people living with mental illness and those who may hold stigmatizing views. Such contact humanizes mental illness, dismantles myths, and fosters empathy. Studies have repeatedly linked interpersonal contact with reductions in prejudice and discrimination. In addition to social contact, education plays a critical role. It's essential that we educate ourselves and our communities about mental health, dispel myths, share factual information, and challenge stereotypes whenever they arise. This can be as simple as engaging in conversations openly, correcting disinformation, and promoting mental health literacy at schools, workplaces, and through public campaigns. Another key point is encouraging and supporting treatment. Stigma often breeds shame and fear, which deter people from accessing care. Normalizing treatment and mental health maintenance, as we do with physical health, is imperative. When people see that seeking help is a sign of strength rather than weakness, stigma loses its grip. Campaigns like Mental Health Awareness Month provide an excellent platform for advocacy and education, mobilizing communities to speak openly and take action in support of mental health. These initiatives foster collective efforts in reducing stigma through a combination of social contact, education, and empowerment. Tackling mental health stigma is a shared responsibility. Each one of us can contribute by talking openly, educating others, supporting those affected, and advocating for policies that promote appropriate access in mental health care. By doing so, we move towards a society where mental health is respected, understood, and embraced without judgment. Thank you for joining Guiding Star Counseling in this discussion of mental health stigma. If you or someone you know is struggling, please remember help is available, and seeking it is a courageous first step. Together, we can break down the walls of stigma and build a healthier, more compassionate world. If you found this information helpful, give it a like, share it with someone who needs it, and don't forget to subscribe. Until next time, take a deep breath. You're doing better than you think.